Welcome to our weekly live session about plastic surgery. My name is Eduardo Favarin.
I'm Juni Favarin.
We are plastic surgeons in the city of Criciúma, Santa Catarina, and we have 16 years of professional experience as plastic surgeons. Today we will talk about
lipoabdominoplasty. Actually, we're going to talk about abdominoplasty, but the technique we use the most is still lipoabdominoplasty, right? But today, we're going to talk all about abdominoplasty. So shall we get started?
Let's go.
Okay. So I think the very first question we should clear up is, what's the difference between a lipoabdominoplasty, a liposuction, and an abdominoplasty? They're three different things and they have different results, right? And actually, lipoabdominoplasty is the combination of the two, but the result isn't just 1 + 1. Do you want to explain?
Exactly, that's correct. Liposuction then is the removal of fat, right, using cannulas through suction without large incisions, just small incisions. Abdominoplasty would be the removal of a strip of skin and fat, tightening of the muscles, and closing the skin with a new belly button. Lipoabdominoplasty is the combination of both surgeries when we combine liposuction with abdominoplasty. Actually, it's indicated for those patients who need an abdominoplasty and have a thick layer of adipose tissue. So if we only do an abdominoplasty on these patients, the result will be poor. So combining liposuction with abdominoplasty gives the abdomen better definition, a better shape, visible muscle lines, and much more natural results.
And just an addendum, right, which I think is worth clarifying. The amount we can liposuction in a regular liposuction surgery is greater than what we can remove in a lipoabdominoplasty. What does that mean? We are able to make the flap, that is that layer of fat that needs to remain under the skin, thinner in a regular liposuction. Lipoabdominoplasty can thin it out, but not as much as regular liposuction. And why is that? Because we need to separate the skin, so we end up damaging some of the small blood vessels in order to close the muscles. So that's something really important, which is why we always emphasize that the closer the patient is to their ideal weight, the better the aesthetic result will be. It always looks better, but it's that difference between looking great and looking perfect, I would say.
Exactly. So lipoabdominoplasty is a body contouring surgery, one of the most important surgeries, I would say, which combines a bit of liposuction. Of course, usually when we do lipoabdominoplasty, we also perform liposuction on the back, flanks, and enhance the buttocks. We look at the patient as a whole, not just as a single body segment like the abdomen. So a very common surgery is liposuction combined with lipoabdominoplasty. That's the surgery.
Good point.
Losing weight is very important because it reduces visceral fat, the fat that's inside the abdomen. There's no way around this fat. With plastic surgery, we can't fix that. So ideally, patients should come in at a good weight, close to their ideal weight, have the surgery, and then lose a little more weight afterwards. If you have this surgery while you're significantly overweight, and what does that mean, being significantly overweight? A BMI, body mass index, above 27 or 28.
Right.
The results are poor, so we don't recommend anyone who's overweight to have the procedure. First, lose weight.
Let me tell you about a case that happened. This week I saw a patient who had a really good BMI. She had a BMI of 25, which is a normal BMI, meaning her weight to height ratio was fantastic. That means, for example, a woman who is about 1.65 meters tall would weigh around 65 or 66 kilos. And then all our patients who come in for consultations for body surgery, breast surgery, liposuction, or abdomen procedures, they all undergo a bioimpedance test. What is this test? It doesn't just assess your weight in relation to your height, it evaluates your body composition. And why is this important to us? For cases like this patient who had an ideal weight, but she had a lot of fat, a high body fat percentage, and a low lean mass index, a low amount of muscle. And then she asked me, "Doctor, do I need to lose weight to have the surgery?" I told her, "Lose weight? No. You need to change. You need to lose some body fat." The normal for a woman is up to 24%, and you need to gain lean mass, which means gaining muscle. So basically what she needed to do was exercise and increase the amount of protein in her diet a bit. That will make her results better. Regardless of whether you have more or less lipo, the results will always look better the more muscle mass you have. Right?
Right, absolutely right.
We're getting a lot of questions, so I think we should start answering them, honey. How long is the recovery time before going back to work? Great question.
Well, if it's a job that doesn't require physical effort, like office work, for example, 3 weeks. If it's a job where you have to stand all day, like a teacher, for example, about 30 days. After 30 days, patients can sleep on their side, drive, have sex. So I think 30 days is the most general answer, right? And how long should you walk bent over, honey?
That's a question everyone asks. So I don't ask anyone to walk bent over.
Not anymore, right?
No, I let patients walk upright. I just ask them not to stretch out completely, because when we walk, we can walk relaxed, like when you see teenagers walking down the street, kind of slouched. So you should walk like a teenager, kind of slouched, really relaxed. But you can't walk like this, all stretched out with perfect posture. You need to stay a bit more relaxed, so you don't put strain on the scars, so you don't feel any pulling, because I think everyone already knows, right? We don't use drains in the surgeries. And for us to achieve good results, to avoid hematomas and seromas, what we do is place internal stitches. So we separate the tissue, close the muscle, and then reattach the skin. And we attach it with stitches. So if the patient keeps stretching too much, she starts to feel that pulling sensation. So we ask them to just stay relaxed. The secret is to stay more relaxed.
I have many patients who have spinal hernia problems. So,
with back pain, right?
Back pain, already existing problems, known hernias, and then I do the surgery and ask them to stay bent over as little as possible, right? Just slightly. This is just for about 7 to 10 days. After that, you can walk upright again. So today, we restrict our patients much less than we did at the beginning of our careers, right, dear? At the start of our careers, when we were more...
We used to be more demanding.
Restrictive.
So, and there's something else I think is worth mentioning. There's a study, it's not new, it's probably about 4 or 5 years old. It was published around the time of the pandemic, and it showed that patients who underwent abdominoplasty or lipoabdominoplasty, who had correction of abdominal muscle laxity, experienced improvements in urinary continence, better bowel habits, and less back pain. And why did this happen with these patients? Because you improve the tone, you improve the anatomy of the muscles that form the abdominal wall. And when you do that, you automatically improve the patient's posture. So that's a really interesting finding. We noticed this with some patients who would tell us about it in the office, but we didn't really know how to explain exactly why. And then this study came out, I think it was in 2017 that it was published. It was really interesting and it got a lot of attention at the time. It was Katya. I wanted to know about Renuvion. Great question. The first question I'm going to ask you, honey, is, does Renuvion replace abdominoplasty? That's another question patients ask me during consultations.
Yes and no. Yeah, let's imagine, before answering what Renuvion is, let's picture the abdominal wall with 3 layers, right? The skin, the fat beneath the skin, and the muscle. Abdominoplasty is indicated when these 3 structures are altered. The skin with sagging stretch marks. The subcutaneous fat is hypertrophied, thicker, increased in size, right? And the muscle is stretched, loose, separated. The term used for the separation of the 2 rectus abdominis muscles here is called diastasis, and also hernias. It's very common for us to find hernias in the belly button, hernias in the abdominal wall when performing this surgery. So these changes, once you have changes in all 3 layers, abdominoplasty is very well indicated. Now imagine a patient who doesn't have sagging skin, no muscle changes, and just has increased fat, right? What do we recommend for this patient? Only liposuction. This is a 25-year-old patient who has never been pregnant, young, or 30 years old. Let's think about a 35-year-old woman who has had a pregnancy. The injury, the damage to the abdominal wall, to the abdominal muscles is minor, just a slight diastasis. There is hypertrophy of the fat because she gained weight during pregnancy and couldn't lose it. And the skin has mild sagging. What should be done for this 35-year-old patient? No, this is not a good case for liposuction for abdominoplasty because we don't need to remove a lot of skin. We don't need to plicate the muscles, but we do need to remove the fat. But she does have moderate skin laxity. Is this a patient for liposuction alone? No, because liposuction alone can actually worsen this skin laxity. So this is a good patient for liposuction with Renuvion. And what is Renuvion? Renuvion is a technology that combines helium gas with radiofrequency, creating a flame, which is plasma. Plasma is the fourth state of matter. We have the liquid, gaseous, solid states, and plasma. So with the patient, we first perform liposuction, as if we were extracting honey from a honeycomb. We remove all the honey, which is the fat, and what remains is the honeycomb, which is the structure called the fibroseptal network. After finishing the liposuction, we use Renuvion, which is also a cannula, and it is passed through this fibroseptal structure. It stimulates collagen production by heating this structure. And as this structure heats up, it contracts. It stimulates collagen production by up to 80%. In this area, the stimulation is strong, right? And it treats skin laxity. So Renuvion is a technology that is combined with liposuction to treat skin laxity, and it is an invasive technology. It's not something that is applied over the skin. It works internally.
Both Renuvion and BodyTite are two technologies that are applied from inside the skin, right? And generally both have more or less the same results, the same indications, and then it varies from case to case how we recommend them. I'll use the example of Eduardo's patient, but now let's suppose that this same patient has diastasis, that is a separation of the abdominal muscles, right? So what should be done? She doesn't have enough excess skin to do an abdominoplasty. She would respond well to Renuvion, but her muscle is separated. So if we only do liposuction with Renuvion, she'll still have that rounded appearance of the abdomen. Today, there's a third option, which is to combine liposuction with technology and a technique for closing the muscles that we call endoscopic plication. So we use those forceps that are used for abdominal surgery, the ones that make small incisions in the belly. But
the ones for video surgery, right?
But instead of going into the abdomen, we separate the skin above the muscle and close the muscles while watching on a monitor. So we can perform a procedure similar to abdominal muscle closure, but without a visible scar, right? A slightly larger incision is made in the lower abdomen area, but it's still a very small scar, just like a video surgery port. So it's a very interesting technique for patients who fit this description. It's not a technique, let's say, that we use every day. It's more of an exception, but it's another tool we have to help patients address their concerns. This was something we didn't have until about a year ago, and now we have this additional treatment option. And I have a patient, I think she's from Blumenau or Joinville, who's coming in July specifically to have this surgery. And the recovery is very similar to that of an abdominoplasty.
Yeah, why go through all of that, right? Endoscopic procedure combined with Renuvion to avoid leaving a scar on the patient.
Yeah, and if you do not have enough skin laxity or elasticity,
no need.
Yeah, it's not a good indication for an abdominoplasty. So there's a lot of variation in technique, right, in how to treat the abdomen, exactly because each person has a different body, a different concern, a different anatomical change. So the techniques are created and developed to solve the problems that patients present to us.
This week, I also did a surgery, a variation as well. Yeah, a 48-year-old patient, someone who eats really well and is very physically active. And what happened with her? She aged really well, without sagging. And now she came in to have a small liposuction on her back and abdomen. Her abdomen, she's had 2 pregnancies and her abdomen doesn't have much loose skin, but there was a diastasis that needed to be treated. So I did a mini tummy tuck combined with BodyTite. Am I making things too complicated now? I am, right? I did a mini tummy tuck. I cut and lifted the upper part of the belly button because the mini tummy tuck.
From above the belly button, it was treated with technology, and from below the belly button, it was treated with skin resection.
Yeah, but with a smaller scar. That's possible. And without making a scar on the belly button stayed the same. So from above the belly button, I used Body Tight, but I also detached and tightened all the muscles. So there are
several options. That's the truth. How many kilos can you remove in a surgery? In this case, for a chubby patient. Look, with 145 kilos.
Look, honestly, it's generally much better to lose a significant amount of weight first and then come in noticeably slimmer for the surgical procedure.
Yeah.
Right? You'll get a much more satisfying aesthetic result and you'll be much happier.
And with less risk of any complications during the surgery. I've had patients who came in overweight, already had excess skin folds, and even so, I asked them, in this case, I recommended a SUR, asked them to talk to a surgeon who does bariatric surgery. The patient lost another 50 kilos, came back for the surgery, and was really happy. After having abdominal lipo, how long until I can return to work and go back to the gym? I've already done it with you and I want to do it again. How are you, Jolma?
So, Jolma, you can go back to work after 30 days. As for physical activity, you can start walking after 45 days. Walking and biking after 60 days. 60 days is also when we remove the compression garments. And at 3 months, gym. Functional, whatever you want to do.
Yes, it starts with 2, physical activity, and with 3, that more strenuous physical activity. Oh, Vanya. BMI, she already gave the description. BMI of 21, grade 1 and 78 with 70 kilos, thin patient.
Pretty tall, right?
Excess skin below the navel and also on the flanks. What procedure would you do? So, depending on your skin laxity below the navel, I would try just technology, otherwise a mini tummy tuck. And on the sides, I would try technology because the skin on the back, right, that back skin, it usually has a thicker dermis and responds better to technology.
By technology, we mean Renuvion or Body Tight.
Renuvion or Body Tight. When does it not work so well? When the patient has stretch marks, Post-bariatric surgery patients, smokers, patients with stretch marks, sometimes the skin doesn't retract as well. But aside from these exceptional cases, generally for the back, we recommend technology.
Yeah, and then surgery.
Right.
Yeah, when the laxity is very severe, the technology might not deliver results. Then it's a circumferential abdominoplasty, where we make an incision all the way around the patient, 360 degrees. The scar stays completely below the swimsuit or underwear line, and then the laxity is really treated by excision.
Yes, surgically that's...
For more advanced cases...
Good evening. How long after surgery can I remove the splint? I think we need to explain what that is first, right?
Yeah, the splint it's like a foam that we use, which we place along with the compression garment and also with diapers or cloths. Usually we put the splint on after 7 days because up to 7 days we don't compress the patients too much since it's the first week, right? Starting from 7 days, we begin to tighten it a bit more and we put on this splint, which is a slightly firmer foam to provide more even compression. And sometimes the splint goes all the way around 360 degrees, covering the back and the abdomen. And we only use it for 2 weeks. So, from the 7th to the 21st day. And we remove the splints after 21 days.
Yeah, so if the patient is progressing well, right, if she's not too swollen, that's usually how it goes. Look, Shimini Santoni said, good evening. Kalyana, good evening. I'm 37 years old with little sagging. Is it better to do lipo with Renuvion or a tummy tuck? In this case, if either method is possible, which one would you recommend? Lipo with Renuvion. Faster recovery, no scarring, no downtime. So you can have it done on Friday, and by Monday you can go back to work, you can drive your car. As long as you're wearing the compression garment, wearing the taping, using those pads, those cushions we talk about, there's no problem at all.
Or at most, a week of rest.
No doubt about it, we will always tend to recommend the least aggressive surgery, the one that leaves fewer marks, less scarring, and allows for a faster recovery. Now, 37 is an age where the clock is on your side. You're still a young patient. Maybe if it were the same case and you were 50 years old, we would think differently. But at 37, I would definitely give technology a chance to work.
I'd like to know 2 things, right? If you've had major weight fluctuations and how many children, how many pregnancies.
This is part of our basic medical history during consultations.
That clarifies things a lot.
I'm 43 years old and my dream is to get a tummy tuck. Am I too old to have plastic surgery? Not at all.
No.
No, you're very young, 43. I'd say that being in your 40s is actually a great age to make this decision because you're mature enough to know what you want, to decide if you're okay with the scar, and you're still very young, your body is still really healthy, and you'll be able to enjoy your results for a long time. Don't think that way, okay? 43 is very young.
Yeah, most patients at 43 have already decided, right, about their family, how many kids they want, right?
We missed an important detail.
They're not going to get pregnant.
Whether or not they're going to have more children, that's another detail, right? It's not absolute, but we always advise patients to wait to have an abdominoplasty until after they've finished having children, because pregnancy is always a major event in a woman's life, and it always changes our bodies a bit. So it's really important that for us to do a surgery of this level, with this degree of correction, it's best that you don't have this kind of event afterwards. But if you want to get pregnant...
No, it's not a contraindication.
We've actually had some patients who had an abdominoplasty and then had children afterwards.
Either accidentally or because...
Or because they got married again. Yeah.
They started a new relationship, right?
Exactly. So it's not a definitive rule, it's just a recommendation. Luciline asks, is it advisable to do aesthetic procedures to lose weight or to have an abdominoplasty? So here's the thing. They're different things.
To lose weight, the best is a nutritionist and physical activity. Even better and more important is a nutritionist, your diet correcting your habits. Aesthetic procedures won't help you lose weight.
No.
They won't be very effective.
No.
It's something you have to do yourself. And abdominoplasty surgery isn't for weight loss. It's to treat excess skin, muscle laxity, possible hernias, localized fat deposits, hypertrophied adipose tissue in the abdomen. But to do the abdominoplasty, it's interesting that patients are at their ideal weight or close to it, right? Because otherwise the result is not satisfactory.
So abdominoplasty is what comes after you lose weight, after you reach your target weight.
In fact, one source of patients, right, that we have are ex-obese patients. Patients who lost weight, whether by having bariatric surgery or by really changing their lifestyle, right? Patients who lost 20, 30, 40, 50 kilos, right? And this is very common, right, in the clinic. I think every week we do surgery at least on one type, on a patient like this.
But a surgery is not just about the surgeon. It requires a team, it needs a routine, and it needs equipment. So when we schedule a surgery, there's a whole team involved, right? There's an entire process happening behind the scenes. Let's say it's like wanting to put on a concert with only a conductor. You're missing the musicians, the theater, the audience. You're missing everyone.
Just so you have an idea, we've been operating here for 16 years in this city, and 99% of the time it was at the same hospital.
The same hospital. We actually prefer to always do it in the same place because it creates a routine. This routine is essential so that everything is always done the same way. Every time you create this routine, when you systematize what you do, the risk of having a complication or a problem or something unexpected happening, it decreases. So we really believe in that. It's the same principle that aviation uses with checklists. So this is our checklist. We need to have this routine so that everything happens the right way. In fact, no surgeon likes, for example, to do demonstration surgeries outside their own hospital because the routine changes, the instrument tray changes, the assistant changes, the anesthesiologist changes, and so it's never the same. That's why we only operate here, always in the same hospital. I'm 63 years old. So, Ivanilda, age is not a barrier for you to have plastic surgery. What you need is to be in good health, okay? So we just need to know how your health is. Alexandra asks, is it common for the belly to be swollen after a tummy tuck?
Yes, postoperative swelling is quite common, right? I would say that in the first 3 months, that's the initial period after surgery, and that's when this more persistent swelling occurs. As the weeks go by, right, what happens? Patients wake up with very little swelling, they say they're flat, looking wonderful, and as the day goes on, they start to swell up and get really bloated, as they put it. This keeps improving, and by 6 months it's much better, with the final result at about a year, right?
Uh-huh.
A good diet, physical activity, and keeping your weight under control. All of that will help improve the results, including reducing the swelling.
So I was actually going to pick up on that point from Alexandra's question. For a few months now, we've been using a patient preparation protocol at the clinic because one of the causes of excessive or prolonged swelling is precisely that the patients are already inflamed. What does it mean, this term, being inflamed? It means your metabolism is shifted towards sugars. All carbohydrates, right? Everything we eat that contains sugar, not just white sugar, but anything with carbs, causes our body to shift hormones in one direction, to shift our metabolism in a certain way. And this causes an overload on certain cells in the body. And that's what makes us inflamed. This excess inflammatory process increases swelling, slows down healing, and raises the risk of hyperpigmentation. So what have we been doing? We have been advising patients to improve their diet, which is something we already recommend to everyone. And we have also been supplementing these patients with certain types of medications, such as antioxidants, some types of vitamins, and sometimes certain amino acids. All of this is to try to improve that sensation you have of post-operative swelling, to enhance healing and reduce the risk of infection. So this is a line of reasoning that has been gaining a lot of traction among surgeons, and in our technical opinion, it makes a lot of sense. So we've started to implement it with our patients, right?
Yes.
My husband has lipomatosis. Is it possible to remove the lipomas along with liposuction? So we can't remove the lipomas with liposuction. We can reduce their size, right? When it's a lipo, there are several types of lipomas. When it's a very round lipoma, it's usually better to make an incision and enucleate it. When it's a sessile lipoma, with a very wide base and in an area where healing is poor, we try to lipoaspirate these lipomas, but in
general, with these lipomatosis, I prefer to just make incisions and remove them whole.
Me too.
With anesthesia.
I think so too. And we do it in sessions.
Yeah. I once had a patient who was engaged and had her wedding date set, and when she went to try on her dress, she noticed a swelling on her shoulder in an area where healing is really poor. The wedding was scheduled for like 40, 50, 60 days away, right? So in that case, I did a small liposuction. And to this day, that patient has never come back. The problem is probably solved. So every case is different, but in that situation, it was a lipoma in an area that healed poorly, right?
Yeah, that's well said.
Everyone, thank you very much for your participation. Have a great week, everyone, and next week we'll be back here with a new topic.
Shall we talk about arm surgery?
Let's do it.
Let's do it. By request, next week we'll talk about arm surgery. Guys, big hugs and have a great week, everyone.